If you're thinking about research, the best thing is just find something that you're interested in and get started. That way you're going to be learning about the process as you're going. It doesn't have to be something huge. I mean, all of the nurses, as part of your studies to become a nurse, you had to do research anyways. So I guess looking at the problems that you find, oh, I'm not sure what to do in this situation, or that's possibly one thing for research, but another thing could be, well, there's this problem that I come across clinically and there's no solution for it. And starting the research path that way. So you don't need a big project to actually get started. Starting to get some experience and just letting your curiosity get the better of you and start looking into it, and things grow from there.
The one or two things I would tell nurses is that it doesn't have to be a big high-level randomised control trial to begin your research career within your clinical area. So think about something related to patient and family care, or even staff within your area, and begin your project or your research work in that clinical context where you are likely to have more support to begin that. And also it's meaningful because it's something that you participate in on a day-to-day basis.
It is very achievable. You can 100% do research if you have the desire and passion and willingness to learn. It doesn't need to be overly complicated. It doesn't have to be, p-values and odds ratios and regression models and all of that. I think try and find the support in your organisation, like-minded nurses who are interested in research. We're all here to help, and I think you'd find a lot of nurses that are willing to support nurses who want to be involved in research that aren't involved in research.
In my own clinical experience or research experience, I would never have been able to do what I have done or undertaking if I didn't have a mentor. That mentor is there for you to give you the belief, the strength that you can undertake a body of nursing research, but also them bringing in their expertise of nursing research to help you grow as a researcher, and to make undertaking nursing research in your own clinical practice more feasible and doable. Building on the mentorship, but giving them the belief that clinical nurses can undertake research, that it should be just part of our nursing practice, that we evaluate the work we do, and that we can then, through the evaluation, the learnings of the evaluation, be able to put that new learnings into practice, and it should just be part of our everyday clinical nursing.
I think it'd be to think about embracing a culture of inquiry, looking at your practice, reflecting on your practice, and knowing that things aren't ever stagnant and things will always change, and to actually use the literature, talk to people and build relationships and networks with other staff rather than just within your own unit. And even that the smallest amount of nursing-led research can actually have a pretty decent effect on the patient, the family and their experience.